Hey guys, I hope you're all well. We are getting a ton of questions about the use of cloth masks in public, so I thought I would create a little video to answer the top questions and maybe provide a few tips. Here we go. As most of you know, the CDC released a statement recommending that everyone wear a cloth mask in public. They did this because we now realize you can transmit or spread the coronavirus even if you're asymptomatic, no symptoms at all, or pre-symptomatic, several days ahead of knowing you even have the disease. So, CDC recommends anytime you're in public to wear a cloth mask. It's important to mention that wearing a mask is in addition to social distancing. We still need to maintain 6 feet away from anyone, but at times this is difficult, like when you're at the grocery store or Costco, or perhaps during a doctor's visit. Cloth masks can be made at home. In fact, there's several ways to do it on the internet. I'll attach a video that shows our own Surgeon General making one out of 2 rubber bands and just a piece of cloth. But this is a cloth mask that somebody made for me. You can see it's pretty fancy. It's got great fabric. It's got ties, although some of these obviously have elastic straps that do the same thing. A couple of do's and don'ts. First of all, always wash your hands before you put your mask on. Do wear your mask as high on the nose and low on the chin as you can. Do not wear it at the tip of the nose or down below the nose. That's not good. Do not expose your chin. Certainly do not pull the mask down below your chin. It's providing no protection here. And so you want to do your best to wash your hands, put the mask on. Any adjustments you'd make to your mask should be at the tags, not on the face of the mask itself. Now you can see that a cloth mask is fairly loose fitting. You can see the moisture from my speech fogging up my glasses. That's because this mask provides some protection, but it's not technically PPE. I wanted to mention, when you wear a cloth mask in public, you're providing more protection for those around you than you are for yourself. The reason why is when we talk, those water vapors are coming out of our mouth, and if we have a cloth mask in front of our mouth, we're catching those vapors and blocking them from being shared with others. We mentioned previously that a cloth mask is not technically PPE, personal protective equipment, but a surgical mask or face mask is considered PPE, along with the N95 masks that we'll talk about here in just a second. Now, the surgical mask is actually regulated by the FDA. It looks very similar to the cloth mask that we looked at before, but there are specific regulations and criteria for the materials used and how they fit on the face. You can see this surgical mask actually has a face shield attached to it. They're disposable, they're loose fitting, and they're meant to block large particle debris like during surgery sprays, splashes, or splatters. Still not providing the protection of the small micro droplets that may contain viruses. This is an N95 mask. There are specific regulations in how they're made and used. They're controlled by the FDA, a branch of the CDC, and OSHA. So an N95 mask is actually a Class 2 medical device. When you use one of these masks, you want to do all your manipulations through the ties, again, not touching the mask itself. You'll notice that once it's formed around the nose, there's no fogging the lenses, so this is a very tight fit, as opposed to the loose fit of cloth masks and those other surgical masks. A very tight fit around the mouth and nose, and the reason why is because it can block very small particles that could contain viruses. Much more protection with this type of mask than the other masks we've discussed. In summary, be safe, wear a cloth mask in public, and reach out if you have any questions. Stay well.